Hey everyone, welcome back to the channel. My name is Dr. Jim, and today we're talking about something super important, especially for that aging population, for those who are in their 30s, 40s, and thinking about the later years of your lives. We're talking about how to build and maintain strong bones to prevent osteoporosis. And trust me when I tell you, prevention is key here. So stick around. These top 7 tips could be life-changing for you or someone you love that is in this current situation and thinking about this topic. And especially the last tip for those people who are currently on a weight loss program and thinking about like fasting. So you want to stick around for that one. First, talk about what causes osteoporosis and what is osteoporosis. It's actually a combination of factors. There's a combination of aging. As we get older, our bones naturally lose density. Hormone changes, especially in women during menopause. Lifestyle factors like poor diet, lack of exercises, smoking, excessive alcohol, genetic components as well. So if your family has a history of osteoporosis, you might be at higher risk. However, I do think that lifestyle changes do play a greater part than just your genetics alone, because due to epigenetics and how you can turn on and off those. So now that you kind of understand what are some of the contributing factors, let's talk about type of bone loss that happens during osteoporosis. There are 2 main types, right? So one is trabecular bone loss, and the other one is the cortical bone loss. Talk about trabecular bone loss. This is the spongy, honeycomb-like bone inside your bony structure. It's the first to weaken in osteoporosis, make your bone more fragile. Now, on the outside of the bone, the thicker layer is called the cortical bone. And this is hard. A thicker surface, the outer layer of your bones. And over time, it can thin out, make your bones weaker overall. Think of it like this. Trabecular bone is the inner framework, and the cortical bone is the outer shell. And when both start to weaken, your bones become like a hollow tree. They look strong on the outside, but can snap really easily. And unfortunately, you don't know if they're weaken because the trabecular bone inside weakens first. You can't see these changes unless an x-ray has been taken for some other reason, or you've been taking a regular DEXA scan, which is a higher intensity x-ray to look at the density of the bone specifically. The good news is that osteoporosis is totally preventable and manageable, and here's how you can keep your bones strong. Let's talk about the 7 top tips. And the most important tip number 1, engage in weight-bearing exercises, training to load your bones axially as well as shear forces to actually kind of work our way up to this. So I always recommend my patients will start working on cardiovascular based exercises until you get a decent level of fitness, understand how to engage your muscles and how to warm up and feel good. Just doing endurance-based exercise. Once you're through and you've had a good history of like 2 to 3 months of doing kind of cardiovascular exercise, now you really want to think about weight-bearing exercise. So that's weights. That's also loading, axial loading your spine, as well as shear loading your spine. So exercise is one of the best ways to strengthen your bones. Now, weight-bearing activities like walking, jogging, and dancing put stress on your bones, signaling them to grow stronger. If you don't have those stimulus, your body does not get stronger. So all the other tips I give you later really depends on how much activity and how much engagement you have on and stimulus you have on the bone. Now, strength training also helps by improving muscle mass. So the thicker and more muscle you have that's supporting the bones, the more protection there is, say if you do fall. And the more muscle mass there are, it creates more shearing type of load onto the bone, which is another stimulus. That pulling onto the bone is another stimulus for it to grow. And the 2 bigger components, and the ones that fracture the most as you go into older age, is going to be your hips and possibly your spine. So you want to make sure there's loading, good axial loading on top, like coming from top to bottom, as well as that shearing load with the muscular exercises. Research published in the Journal of Bone and Mineral Research just in 2023 suggests that high impact exercises such as jumping and resistance training, at least 3 times per week significantly increases bone density. Studies also show that strength training exercise should focus on progressive loading, building yourself up slowly, but not only just staying put in one type of, bicep curls or tricep extensions or just body weight squat, but no, over time, adding more load, adding more weight, and reducing the amount of repetitions as you increase the amount of total load. Now, the recommended frequency is 30 to 60 minutes of weight-bearing and resistance training exercises at least 3 to 5 times per week. Out of all the tips, this is the key one because it really needs to drive the stimulus for your body and chemically, hormonally for your body to change and to be able to grow and strengthen that bone. Tip number 2, increase calcium intake. Calcium is the foundation of strong bones, playing a crucial role in building both the trabecular, we talked about the spongy bone on the inside, and the cortical, the dense outside components of the bone structure. However, not all calcium sources are equally effective. I love it when you get it from food, but if you're taking it as a supplement, adults need about 1,000 to 1,200 milligrams of elemental calcium daily. Make sure the supplementation say elemental calcium, which refers to the actual amount of the calcium available for absorption. This essential mineral can be obtained from dairy products, of course, leafy greens, almonds, and fortified plant-based milk. And if dietary intake is insufficient, calcium citrate is a highly absorbable supplement. Even on an empty stomach, you can take this product. 2023 study in the Journal of Bone and Mineral Research found that calcium citrate has a higher bioavailability than calcium carbonate, meaning more of it is absorbed into the bloodstream, particularly for the individuals with lower stomach acid. Since the body can only absorb a limited amount of time, it's best to take supplements in a divided doses of 200 to 600 milligrams throughout the day for optimal absorption. So we talked about 1,000 to 1,200. So you want to probably split that up to 2 to 3 doses throughout the day. So always check the labels for the elemental calcium content and consult your practitioner if you have any questions. The third tip, maintain sufficient vitamin D levels. Component and one of my favorite vitamins that I have to take throughout the year because we're in the northern parts of North America, so we are hardly getting sunshine for about good 4 to 5 months of the year because it helps your body absorb calcium. It takes the calcium from the food or your supplements into the actual bone. It's a transport to get it into your bone. A 2022 meta-analysis in American Journal of Clinical Nutrition found that individuals with insufficient vitamin D levels had significant lower bone mineral density, increasing their risk for fractures. You can get vitamin D naturally from the sun, of course, but if you live in the colder climates like we do, eating vitamin D, rich foods like salmon, egg yolks, and fortified dairy can help. Supplements are always an option, and that's probably where I get majority of my vitamin throughout those low light part of the years. So at least 800 to 1,000 IUs. Personally, I'm taking vitamin D also for immunal health as well as serotonin production in my brain during those low light seasons. And I take up to about 4,000 a day on average, and a little bit more if I'm feeling sick. But the recommended dose is about 800 to 1,000. Tip number 4, prioritize micronutrients and minerals for bone health. So I'm talking about specifically magnesium, and we're talking about potassium. Research published in Osteoporosis International Journal 2023 highlights that magnesium also plays a crucial role in bone mineralization and may reduce fracture risks by improving bone quality. Potassium found in fruit and vegetables help neutralize bone depletion acids in the body. So making sure you upping your ante in regards to potassium. It's also a great electrolyte as well for muscle fatigue and tiredness and tightness. So aim for a colorful plate of every meal to ensure you're getting enough essential micronutrients. Number 5, avoid smoking and alcohol consumption. Now, smoking weakens bones by reducing blood supply and interfering with the function of bone formation, and especially at the cellular level. A 23 study in the Journal of Bone and Mineral Metabolism found that long-term smokers have a 25% higher risk of osteoporosis and fractures due to decreased bone mineral density. Excessive alcohol consumption had a similar effect, as it disrupts the calcium absorption from your gut and suppresses the hormones responsible for bone formation, osteoblasts, right? Research published in Osteoporosis International in 22 suggests that consuming more than 2 alcohol drinks per day significantly increases fracture risks. If you're serious about protecting your bones, it's time to cut back or quit altogether. Your bones and the rest of your body will thank you. Number 6, get food rich in vitamin K. K1 and K2. Now, vitamin K is crucial for bone health because it helps regulate calcium and directs it into the bones rather than the soft tissue. Now remember, calcium is actually important into the muscle tissue as well because it helps the relaxation state of contracting a muscle. So if you feel like you're tight and have difficulties there, you got to make sure you're up to par when it comes down to calcium for the muscles as well. But vitamin K, having it around in your system, helps it get into the actual bones. A 2023 study in Bone Reports found that individuals with higher vitamin K intake had significantly greater bone mineral density and lower fracture risk. Vitamin K1 is found in leafy greens like spinach and kale, while vitamin K2, which plays a role in bone metabolism, is found in fermented foods such as natto, sauerkraut, kimchi, miso, and certain cheeses as well as animal products. In addition to the vitamin K, let's talk about magnesium a little bit more because on the other hand, it's vital for converting vitamin D into its active form, which enhances calcium absorption. Research published in the Journal of Bone and Mineral Research 2022 indicates that low magnesium levels are associated with weaker bones and an increased risk of osteoporosis. Food rich in magnesium include nuts, seeds, whole grains, and dairy leafy greens. Things to avoid. Excessive calcium supplementation can interfere with magnesium absorption, and so it's important to balance these nutrients out. High doses of vitamin K can interact with blood thinning. So if you're on medications like warfarin, you want to talk to your family doctor first to make sure there's not too much to interact and cause more medical issues. Vitamin K helps regulate calcium, while magnesium is essential for bone formation. Leafy greens, nuts, seeds, and whole grains are all great sources. So don't forget to add them to your diet. Tip number 7, avoid very low calorie diets. Doing intermittent fasting or time restricted diets, you want to work on modification of these because eating too few calories can weaken your bones over time. Very low calorie diets deprive your body of essential nutrients, including calcium, vitamin D, and protein, which are key building blocks for bone strength. A 23 study published in Osteoporosis International found that chronic calorie restriction leads to decreased bone mineral density and an increased risk of fractures, particularly in older adults. Additionally, research found the Journal of Clinical Endocrinology and Metabolism suggests that extreme calories deficits can suppress hormones like estrogen and leptin, which plays a crucial role in maintaining bone mass. So if you have any questions in regards to that, definitely talk to your healthcare practitioner or send us a message here. But it is critical that within your feeding window, if you do intermittent fasting, that you're modifying these components or adding components into it to make sure you're not deficient. So how do you really modify fasting for bone health? Let's talk about that. So if you practice intermittent fasting, ensure that your eating window includes nutrition-dense meals rich in calcium, vitamin D, proteins, and magnesium. A 23 study in nutrition suggests that maintaining sufficient protein intake during fasting helps preserve muscle and bone mass. And we talked about earlier that muscle mass is critical in maintaining bone health because it has that shearing load on the bone while it's contracting. So you want to make sure your muscle mass is not being lost here. And the overall weight in that muscle mass will also create axial loading on your body, which is another stimulus for your body to load to maintain its bone density. Additionally, focus on foods and foods and avoid ultra processed options that lack essential vitamins. Empty calories, right? If engaged in extended fasting, consider supplementing with key micronutrients to prevent deficiencies that could weaken bone over time. Now, always consult your healthcare professional before making dietary changes, especially if you have osteoporosis or at risk. Let's talk about the most important tip here. I think it still comes back to the first tip. Tip number 1, and it's about progressive loading and exercise. It is the most important part because it creates the stimulus and the cascade of cellular events that really stimulate your body to need to be in a phase where you're attracting all these nutrients to the bone. So just by taking the supplementation does not mean the bones will get stronger. You want to make sure, well, to some degree, you want to make sure that you're loading the system safely to ensure that you're providing the stimulus for your body to take on the bone. And that's it. 7 powerful ways to build and maintain strong bones. If you found this helpful, give this video a thumbs up and subscribe. And the next time we're going to be talking about really important topics, so stay tuned. We'll see you on the flip side.